If you get to find out the person that infected you, would you be able to forgive them?
I'm going to be mad. I will change for
Do you know if you have unintentionally infected anyone with HIV?
What made you go and undergo the test?
Have you ever
Guy, that is a valid question. Okay. Let's go.
had sex with someone who does not know you're living with HIV?
Can you remember any scenario that has made you pour out tears?
Since you knew your status, has anybody walk up to you that they want to pay you to affect somebody else?
What? Has anyone paid you to infect? This is going to be a very crazy video. Stick around. This is going to be a very crazy video. These questions, man. These questions. Hello, everybody. Welcome back to another episode of A Bax Reacts. And yeah, we're reacting. We're reacting to another video by Cruz. Yeah, we've reacted to one of their videos already, which is I am living with HIV. Ask me anything. So you guys know about this like thing that they are doing where they invite people that have, let's say, movie-like experiences, or like experiences that some people aren't really common to. Like the other video, my other video, we covered the episode where they brought in a former drug addict to the scene and they asked him different questions about life, like why he did it and things like that. So the video we have on our hands is they invited someone with HIV this time around, and yeah, HIV. That thing they always taught us about in school when we're, from primary school, secondary school, side effects, causes, and all that. Yeah, so I really don't have much to talk about on it. Like, I believe many of us should know what HIV is. Many of us guys that are out there, so to speak, that are engaging, so to speak, that are under the covers, so to speak. Anyway, many of us this is probably our number one fear, contracting HIV. So anyway, without boring you guys too much with awkward talks and sounds, let's just get into the video.
HIV and 20 random people to ask them absolutely any questions of their choice. Can the first question now be asked?
Hi, my name is Adikweju. Were you in a relationship when you got diagnosed, and how has your diagnosis affected your future or current relationship?
I'm sorry. I shouldn't be reacting to everything. I mean, I should, since it's a reaction channel, but diagnosed, really? Come on. You can do better, thank you.
Relationships and dating life. The reason I decided to come today was more of a personal decision because I had an aunt who died of HIV. I didn't get to meet her, so this was like kind of like a building arc for me to get to meet someone and have a conversation because I didn't get to meet her, I didn't get to see her, and I didn't get to have any sort of conversation.
I wasn't in a relationship then, so I've never really actually been someone who is particular about relationships. Till today, I don't really know how it happened. I can't say, oh, this person gave it to me, or I got it. It just happened. If I'm going to be with a partner in the future, the person will be somebody that knows already, so it will not be a thing that I'll have to explain too much to them. Definitely. So if they are like educated and they want to really do it, then fine. But if it doesn't work, then it's still okay.
Yeah, he can't keep it for like a long time. Like, he can't just keep it for a long period of time and then all of a sudden when he's comfortable 5 years into the marriage he's like, oh, I've been living with HIV for a while now stupid that sound like what? So it's best believe if he's going to get with someone in the future, he just come out with it, be honest, how far so thing happened, don't know how I got it, will you still stay with me, and yeah.
Okay, my name is Abdurrahman Salu, and my question is, what made you go and undergo the test? Like, were you feeling something in your body or anything like that?
Why do you
it
have
was
it?
the year of my IT. On my way back from school, I'm O negative, I'm AA, so I don't ever fall sick. So I just noticed that I was vomiting, like, oh, this is weird. I got home, I went for a test, they said it was malaria, I treated malaria, I got better, came back 2 weeks later, said it was typhoid. I treated typhoid. Then that was January. Then February, March, April, I was just deteriorating. Everything was just happening all of a sudden. I couldn't go for my IT. But then I was doing tests consistently. I was going to the hospital, but everything was coming out clean. And I was dying. It was my roommate that asked me that, oh, do you even know your HIV status? And I was like, well, I've been going for 100 tests for the past 6 months. If it was HIV, I would have known from the test results. Then he was like, well, I mean, even though that's the case, why don't you just tick that box? And I was like, well, I didn't have anything to do. So I just wanted to just go and satisfy my curiosity. And that was how I found out.
Do you know if you have unintentionally infected anyone with HIV, especially before you were diagnosed?
Oh, the time I was sick, the thought of you're sick from the January till June of 2015 when I was sick. I was deteriorating, like, at that point, sex from here. When you're thinking about how you want to like, survive, you're actually praying to God. So when I found out,
sex isn't the only way you can contract HIV now. I mean, sharing the same nail cutter, different things that would have been none the wiser. Like up till a few years ago, I still had no problem using somebody else's nail cutter, if I'm being honest, because I always had very long nails and maybe I had to urgently cut them due to we were playing a match or something. So, I mean, sex is kind of strange for you to think that only sex is the only way you can contract it. But okay, I guess it's his thing. So like,
that I was positive, I told myself that until I realized that, oh, I'm undetectable, no sex. And if I'm going to even have sex, it has to be protected because I don't want to hear stories that affect the spine. It would be very, very bad for me to now come and realize that, oh, this person got infected through me.
Yeah. I feel like a piece of shit.
My name is Hassan. I just want to ask, coming from a religious family, what was the initial reaction of your parents?
The reason I ask this is you are coming from a religious home, and even I've not seen it physically, but Nollywood movies, what they depict to us is like, oh, once you have this, even people that have faith, so much faith in God, they are, oh, you are being wayward, you are this, they criticize you.
It took me 10 years to actually, really tell my dad. And when I finally did tell my dad about it, he was very shocked, but he was very loving. Like, he just told me that, oh, if HIV doesn't kill you, you can literally walk on the road and get hit by a bus. So something must kill a man eventually. If this is what it is.
True. I find it very crazy that, okay, you guys know Magic Johnson, like greatest point guard of all time. Many of you should know who he is. For those who watch basketball, Magic has been living with HIV for almost 30 years. 30 plus years, he has been living with HIV. Magic turned 60 like a bit. Magic, how old is Magic? Let me even check. Magic should be about, let's see. Okay, so Magic is 66 years old and is worth $1 billion. Obviously, he's a billionaire. And he's lived that long. So like you said, bro, do you know how many people that were good, like they didn't have any ailment or anything, that are dead today? That they didn't live up to that 66. Just all died at 21. Just all died at 21, X20. And they die. One overdose, the other one got shot. So the truth is that the fact that you have HIV doesn't necessarily mean you can't live it long and fulfilling life. And I mean, his dad had the right philosophy in it if you think about it. So
then it's what it is, but you have treatment. He really encouraged me. Now telling him after 10 years and he still reacted. He just made it look like, why did I wait all this time to tell him? So, and he's been very supportive. We even became closer.
My name is Shino, and I want to ask about your relationship with your guys. If you smoke, and if you guys like smoke together and drink together.
My circle is very tight. I only have.
If you guys smoke and drink together, I thought these were based on his ailments or living with HIV. What does drinking and smoking? You know what? Let me just listen to. But wait, what does drinking and smoking actually have to do with this? Like what? Man, I knew I was going to get some very bizarre questions.
I'm friendly with everyone, but I'm not friends of everyone. My guys are people who have been aware of my status for like longer than I can remember. So there's no type of, oh, I'm hiding from them, because if somebody is your real friend, you don't have to hide from them. And when it comes to smoking, I'm going to talk about the ART medications and how it affects people. So once a person is HIV positive and the person is on ART medications, within 3 to 6 months, the person can achieve something called U equals to U, which means undetectable means untransmittable, which means that once you have achieved that, you can no longer transmit the virus to anyone, which also in
U, undetectable equals to untransmittable. We're going to read this out just for the sake of learning, because personally, me, I don't know about it. So if you guys know about it, though, but me, I want to learn. So yeah, if you know about this, just let me know in the comment section. U, undetectable equals to untransmittable. Scientific consensus confirms that people living with HIV who maintain a consistently undetectable viral load through effective antiretroviral therapy (ART) do not transmit HIV sexually. Okay. U equals to U applies specifically to sexual transmission. It does not mean HIV is cured, and viral suppression must be maintained with ongoing treatment. So, Centers for Disease Control and Prevention, CDC, undetectable transmittable, official endorsements and guidance, World Health Organization. So, apparently, there's a type of HIV you can have that's not transmittable sexually, especially. But there's the other one. That doesn't mean the HIV is gone, but it's there, but can be transmitted, and it can be suppressed apparently. So I actually didn't know about this personally, so it feels good to learn. Feels good.
indicates that you are as healthy as the person that is not HIV positive. So now the question about smoking now becomes a personal choice. But then, like they always say, smokers are liable to die young or whatnot. So it's now your choice.
Okay, hi,
That was
I'm
a very stupid
Angela.
question. I'm sorry.
I just wanted to
That made no
ask how
sense.
life had been after your diagnosis, for like the first 6 months to a year.
The first 6 months was a healing journey. It wasn't easy because where I was getting medications from then was this local hospital. The stigma rate was so high. They will line you guys up at the heart clinic, call you guys by your name, make you guys feel like HIV people, they are there. The healthcare providers themselves, there was this one time I went there, I needed to just cover my face that day because I didn't want her to just get me. And she was like, who are you? You can't enter. I'm the one that come here every time to get my medication. She was like, so why are you coming? I'm like, I don't want to. Like, I had to make up something. She was like,
Yes,
no. And then I had to take off the mask. And I was like, okay, look at me. And she was like, it's not a death sentence. That's why she was trying to now give me one kind of love. So like,
The thing is, HIV actually isn't a death sentence. Let's be honest. But this is going to be very controversial, honestly. It's easy to downplay something that literally has no cure as not being a death sentence when you're not the one that has it. That's just the truth. I understand. Yes, in real time, it's actually you can still, like I said, I just pointed out magic, and like other people too are living with HIV. But the truth is that first 6 months and somebody's telling you it's not a death sentence, bruh. Nah. It's just like you. I know it's not that, but like just like you repeating a class and your first lecture, somebody tells you, don't worry now. Before you know it to be over. We've got like 2 semesters, 3 months each. Sure, you guys get what I'm trying to say. You guys get it.
I have to just say, okay, let me just enter inside. And then you get inside, the doctor will now start giving you Bible, telling you all the possible things that you've done in your whole life that brought you here. And then you have to listen to all of that, because if you don't do that, you are not getting your medications.
What?
Instead reading about the rights of person with HIV, because even my cousin was threatening me that if I didn't tell one of my siblings, she was going to do it for me, and she did. My sister called me like, this is what I heard though. I had to lie because I wasn't ready to like tell anyone that time.
That's so
I was like, I'm
stupid. Why
threatening her
would
that,
you do that?
you disclose my status without my consent, you can lose your license and go to prison. Then she understood that, I now know my rights, and then that was how it stopped. But for those first 6 months, it was not funny because I had to deal with all those healthcare worker drama, people, and trying to like understand that this is my new reality.
Pause. We have 28 days left to the end of this year, and we're trying to hit 350,000 subscribers before the end of the button.
Miss Victoria, can you remember any scenario that
I
has
just
made
had
you go back to the house, to a quiet place, and like pour out tears?
Yeah. Yes.
For someone that has been in the medical line and have been with these people, have to attend to them emotionally, psychologically, and I just wanted to see more from someone that is actually free, someone that has come out to tell the world that, okay, I'm dealing with this and I'm cool.
When I first started taking medications, I was, like I said before, I was sick for 6 months of the year. So, healing is not a thing that will just happen overnight. A friend of mine came to visit my roommates in this hostel, and when he saw me, he was like, "What's wrong with you? Like, why do you look like this?" I was like, "Oh, I was sick for a while, but I'm better now. I'm getting." So he was like, "Just tell me what's the nature of your sickness." I just clocked that this guy wanted more information, and I was like, "No, I'm fine. I'm okay. I'm chill. I'm good." So he was like, "Okay, no wahala." So when he left, my roommates were like, "This conversation is going to come out somewhere." I was like, "Oh no, just forget about it." So 2 days later, a friend of mine called me from school, from another faculty, like, "Are you okay? Are you okay?" I'm like, "I'm fine." He was like, "Oh, please let me see your face." He switched to video. I was like, "I'm okay. What's going on?" He was like, he's hearing in worry that I'm about to die, that I have AIDS.
That must suck because, like you said, some people just want information. That's just the truth. Some people just want information. Some people just want to. Some people already know, but they'll be like, it's like when someone gets expelled and like, how far here's bro, you don't hear anything, guy. You've known for like how long? So I can't believe he actually went through people like that. That apart from not only trying to get information, they already know, just to spread, like, to their group of friends. Maybe they don't want to spread the wrong information, but bro, it's not your secret to tell. Neither is it your gist. So this goes out to all those people out there. If you know you're fond of this, please stop. Like, if you suspect anything, shut up and keep it to yourself. Tell your best friend maybe, but both of you should shut up and keep it to yourselves. I beg. Not everything needs to be broadcasted. Swats.
To you, like, don't I sound fine? You're like, you just be careful that people are saying things. I just forgot about the conversation. Then that weekend was my roommate's elder sister's wedding. So one of my friends came and sat next to me, just the way you're all sitting behind me. Like, a lot of my friends were there too. So he was like, "What's up now?" I was like, "Oh, I'm cool." Like, "Oh, I heard you're sick." And I was like, "Oh yeah, I was, but I'm getting better." So he was not like, "No, I heard that it's that sickness that if you don't take your drugs, you die. Like, that one that you'll be sick for the rest of your life." And then he was amplifying his voice. So everybody was now looking at him like, "Oh, he's like," because the gist has started spreading before that, "Oh, I was about to die." So then when they saw me, and then he was now like amplifying it, so that everybody, I was like, "Why the f are you doing this? Like, why are you asking me this?" Like, he was like, "No, don't worry, just be taking your money, you won't die." I'm like, everybody was now giving me what type of distance. I got up that day from the wedding because
this goes to show you that a lot of people in this country are very emotionally unintelligent. That's just the truth. I just mentioned something now. Yeah, I just mentioned something now about you not wanting to spread it, bro. There's a time and a place for all this shit. No matter how good your intentions, and which one is you will not die. Just keep taking your medication, bro. You know this stuff is a stigma on its own already. Why do you have to? Guy, I actually feel bad for him. I feel very bad for him, honestly, because that can be the most embarrassing thing in the world.
Because of course the scene, and I went back home that day. I cried, like, I tried to, like, I wanted to, like, hang myself, because I felt like, oh, there's, like, nothing to live for anymore. Because if people that are supposed to be my friends, that were supposed to, like, protect me, are, like, stigmatizing me in public, then I really don't have any hope. So yeah, that was the moment that I really, really, really cried.
Madi George, so I want to ask, that night,
yes,
did you go through any therapy to eventually make you feel okay?
about
So I
it?
feel like I'm my own therapist. Because after that night, I had to like while I was in the process of trying to like hang myself and end it all, I was now asking myself at that same moment that if I do this and I go, that means everybody that has something to say about me would win. And I knew that I had some fights left in me. So that was the night I decided that you know what, this HIV, I'm going to like win. I'm going to win this battle. I'm going to, take charge. And then I started taking my medications really seriously and I was eating like I needed to eat so much. And then everything started changing, and then I started adding weight, started getting fat. I started realizing that why am I, because I was not eating like one kind of mad person. That was what led me to the gym. That's now what led me to fitness modeling.
Hello, my name is Ijoma. So
Hi.
I'd love to ask concerning your sex life, have you ever been in a situation where you had sex with someone who does not know that you're living with HIV, right? And you just have sex with the person because you know that you are you. I was just curious to know if maybe he's had sex with someone, and many times people have sex with people and not even know that they live with the virus, and tomorrow the person watches the show and you're like, wait a minute, I had sex with this person and they didn't tell me. So
Yeah, that
HIV is no joke. But imagine sleeping with someone, bro. Just imagine having sex with someone, bro. And 2 weeks later, or a month later, or 6 months later, they come on cruise TV and say things like, "Yeah, I'm living with HIV. Ask me anything." Imagine the way like. Do you guys imagine how? Guy, forget everywhere go first blow, guy. Your mind will be so fucked. Like you won't even know what to think of. Bro, I really want to hear his answer to this question.
That's a tricky one. There's a guideline from World Health Organization about disclosure of HIV status, right? And the guideline states that if you are undetectable, you are at liberty to not disclose your status because you are not putting the person in any harm's way. If you are on your medication and you have confirmed that your viral load is suppressed, you are as good as the person who is negative, except only you decide that, oh.
Well, WHO confirms that people with sustained suppression do not transmit HIV sexually. Disclosure is described as voluntary and based on individual choice. Legal obligations for disclosure depend on national laws. In Nigeria, the 2017 National HIV Guidelines encourage voluntary disclosure for support and partner testing, but do not mandate it. However, federal and some state laws criminalize non-disclosure before sex, and the law does not recognize undetectable status or condom use as a defense. So, I don't know. I guess in hindsight, the person isn't obligated to tell you that they're carrying the disease, but I think it varies. It has based on different jurisdictions. So for some, it's criminal. Other parts, it's the person's obligation. It's the person's choice. It just still doesn't explain. But I think it depends on the country. I think it actually depends on the country. Now, if you read this again, legal obligations for disclosure depend on national laws. In Nigeria, okay. So in Nigeria, it's actually the person's. It's the person is not obligated to tell you whether or not they are living with HIV. Noted.
Okay, I want to tell this person. Nobody has ever come to meet me and say that, oh, you had sex with me and you not tell me, and now I'm positive, because you cannot get this for me because I'm undetectable.
Hi, my name is Mikey. How has your status affected your work relationship? If you're in the professional field, do you have to declare, and how has that been generally, or having to deal with customers?
Funny story is that finding out I was HIV positive, I studied elect engineering. So when I came out from university, I was looking for a job. Jobs were not coming. I was like, oh, what am I going to do? So the organization where I received medications from, I went to them and asked them that, oh, I'm really interested in the work. So they were like, oh, what I studied is not going to it's not within their purview. So I would have to volunteer if I want to join the force. So I was like, okay, I'm interested, and I applied, and they told me that, there's no salary for volunteers. I said, no problem, I'm very interested in the work. I was there for a year and 3 months with no salary. I was just working in various departments. A project came, and I was recommended to work on the project. And while I was working in the project, that was where I met the director of the organization that I'm working in now. And she saw that, this person is doing so well, like his passion is nice. They just created the position, and I just interviewed and I got it. So from there, I started going into data analytics. I started learning how to monitor data, because I was working with all the data across Lagos and other countries. So it's kind of now led me into, where I am today as an M&E person. So the HIV that was supposed to kill me ended up saving my life. It's where I'm working from now, where I'm feeding from, and I'm able to help people. I'm able to do the work, and it's where I still collect my medications from. So nobody discriminates me. My office is like my safe space. You get, so I feel like it's a blessing for me.
It's just challenges in life. We should use that to bring.
The fact that his office has become a safe space for him is very cool. I respect that. I like that actually. Because many of these offices, they'll just be like, from the moment you sign the application form, like, are you living with HIV, and you tick yes, they just immediately, you just find out that they're not giving you the job. But I'm happy that he's been able to find solace in his workplace, man. We all need employers like that will look at the person's character and work ethic other than, yes, I know the health status can be important too, but let's not try and build on that. Don't let that be the only thing we build on.
Move us forward, make us more determined, more passionate.
Hello, my name is Toby. What was your reaction when you were diagnosed?
I had two reactions. At first, I was shocked and scared. And then when the healthcare provider, who was my cousin, told me that there was a treatment, there was a feeling of relief. So it was first scare and then relief.
Fola, my question is, how do you handle the stigma that comes with everything here?
Stigma has been maybe something that I've been quite used to. I come from a very strong religious family, so stigma has been something I already was used to as a child. But when I found out I was positive, I also faced stigma from the healthcare provider, from my friends, from family. So I kind of everything just kind of made me strong. It's not new to me, so I kind of just mentally block it in my head. The idea is the message I'm trying to pass.
Hi, my name is Moyo. I would like to know how you would advise someone that just got diagnosed.
Okay, so I'll tell them that it's very, very okay to feel what they are feeling. It's a process. Acceptance is a process, and it's a journey. So you don't have to feel like, you have to be strong all of a sudden. You can take your time, you can vent, but look for someone that you trust. If you don't trust anybody, then don't tell anybody. But if you know that you have someone that you can trust, then you don't have to be alone, and then seek help as well.
Hi, my name is Busayo. My question is, how has the medication and treatment process been, especially in a country like Nigeria? Do you think access to the proper healthcare is difficult or anything like that?
Access to proper healthcare is not difficult. I would say that in HIV response in Nigeria has been good, thanks to agencies like Lagos State agencies, NACA, some organizations who champion in HIV response. The medications are free, very accessible. You can access them in any general hospital, anywhere, even preventive drugs. But the issue is a lot of reasons why a lot of persons don't respond well to treatment or stop treatment is because of some things that the people tell them, like, I just found out I'm HIV positive, and I go and meet my pastor. My pastor is like, your faith has made you well. Instead of you to tell that person that you need to go and get me.
Okay, that was funny. That was actually very funny. Honestly, I was actually really not in the thick of it at first. He said, go, your faith has made you whole. Look, man, look. I'm a Christian, first of all. I'm a big fan of faith, but your faith has made you whole for HIV. Only in Nigeria, ladies and gentlemen. Only in Nigeria.
You need to start taking treatment. You are telling the person that your faith, but you are telling the person that you still go to the hospital, you still get treatment, and the person dies, and it's not fair because it's killing people and nobody talks about it. Access to healthcare is okay, but we need to start like raising some type of awareness around religious leaders too.
Tonia, I want to ask, is there any kind of diet that you are into that help to boost your immune system?
No. I'm a foodie. I like to eat what I like. I like to eat ewa going. I like to eat rice, ebag, like every.
I personally dislike your going. I really don't like it. No disrespect to those that enjoy it, but I really don't like. I have never been a fan of the Ewago. The whole oil on the top and beans on like I could never. My stomach could never condone such. Not hating, no, but nah, it's just not for me. Sorry. We move.
Other normal food. Like I don't have a type of diet that I have. Once you are taking your medication and you are eating well, you can live a healthy life. You don't have to be on a special diet, except if you want to. It's not a necessity for a person living with HIV who is constantly taking their medication.
My name is Soji. So my question is this: do you feel supported by people around you?
Currently, yes, I do. Like I have so much love around me. I have so much support from my close friends, for my dad, right? So yes, the support that I have for me right now is enough for me. Like I don't feel like I'm lacking anything.
My name is Chigozire. So my question is about your
Sorry, that's not why we're here, my bad. But now fine girl.
medication. So while you're on medication, have you ever had any medical crisis that required you to maybe go to the hospital or you were rushed to the hospital at any point in time?
Funny stories. I had appendectomy in 200 level. I had to go under the knife. All the time that I've had medical emergencies was the time before I found out I was positive, and of course the time I was sick. When I found out that I was positive, from that 2015 till now, I've not ever been in a weird situation, except maybe if I had an accident on the road or something. But yes, I fall sick, I get typhoid, I get malaria like every other person.
And this is the
I know
thing people need to understand. People living with HIV, but you're not so, I don't want to say you're not different. You're not different from every other person because you still have, the virus. But you're not like an alien. You're not like I would argue that you're even more, medically speaking, you're even more alright than sickle cell patients. Some of them, sure. Because a lot of them have episodes. A lot of them have seizures. A lot of them vibrate and do all that. But HIV, you take your drugs, you eat your food, you're good. You can still get sick, like you can still have the non-HIV related illnesses. You can still have your malaria, you can still have your typhoid, you can still have your running temperature, your catarrh, your everything. So, like I said, you're not so different from the normal human being. You're not.
know well enough to take care of myself. So I've gotten like typhoid vaccine, COVID vaccine. I always make sure that once there's a new vaccine coming up, I'm always like there to get, because yes, I'm positive, but I'm trying to stay healthy and look hot and look fine.
Okay, bro. So, my name is David. I know that undetectable is untransmissible normally.
Yeah.
I get you on your ARTs and stuff like that. But like, aside the drugs, are there other like precautions you take day to day? Can I notice your like clean cuts? Nice, by the way. You can't transmit it by sex and stuff like that because you're on your meds and cool like that. But it's still possible to transmit by blood. So, are there other steps you take, like particularly like day to day, to prevent that?
They call it 97, 97, 97 goal, and the goal is that 97% of persons know their status, and 97% of those persons who know their status are on medications, and then 97% of those 97 those persons that are on medications are undetectable. So once you are undetectable, it means you cannot transmit. That is why HIV has not become a state of a emergency or something now. The numbers of HIV.
Another fact check. People living with HIV who maintain a durably undetectable viral load doing consistent antiretroviral therapy do not transmit HIV sexually. U to U applies only to sexual transmission. HIV can still be transmitted through blood, sharing needles, transfusions with contaminated blood, and other non-sexual routes. So basically, You can't. It's not all HIV that you can contact sexually. It's crazy.
Person living with HIV especially in Lagos, you'll be shocked how high it is. But you can take measures, like you can always tell your
You
partner
can always
this is
wear a
so like the person
condom.
is informed, the person makes informed decisions. Do you get? I don't know if that answers your question.
I learned that even with the fact that I've known that yes, if you get HIV doesn't mean you're dying. I've not actually seen anyone that virus face to face. So this, let's say, deep
I have
dive into
never
someone's
seen
like
an
psyche.
HIV.
Okay.
I don't know. Maybe it's where I was raised or the way I was safeguarded or whatever. I have never seen anybody with HIV before, ever. Like never in my life. And most of the people that grew up around me too probably have never seen. Crazy, man. I think this is just a testament to how great our parents were. I guess they raised us in clean environments. They raised us in very upright places. So like we didn't have to see any of these things firsthand. We just heard about them in school and classes, like different things, and like or reading. Or your dad told you touched and told you how far. Don't sleep without a condom. Don't do this. Don't do that. So unless you get HIV. So I mean, you know what I'm trying to say. Is I personally have never seen an HIV patient in my life. Like never.
Okay, my name is James. Your status, how it affected your sexual life, your phone life?
My sexual life has been very good. Other than HIV, there are so many other STIs people can catch. There's hepatitis B, which is deadlier than HIV, but a lot of people don't know about it. Just because I have HIV doesn't mean that I want to go and be having unprotected sex with people. I still want to protect myself from other STIs. So my sexual life still.
I think when you hear STIs, when the guys are talking, I'm like, bro, I don't want to catch anything. It's mostly HIV because why HIV is not even funny enough. HIV is not even the deadliest virus among them. I think it says HPV hepatitis. Okay, sorry. You know what? I don't want to come out here and assume anything, so I'm just going to go online. Let's go online and we'll check this out. If I check many of this. Okay, well, HIV remains one of the most serious and, if untreated, fatal sexually transmitted infections (STIs). Certain other STIs can be considered deadlier in specific contexts, such as causing immediate high volume viral hepatitis B and C, human. Okay, so it's different hepatitis B and HPV. See, the two of them are actually deadlier than HIV. Untreated syphilis. We all know what syphilis is. Antimicrobial resistant AMR bacteria, smallpox. So apparently these ones are way more deadlier than HIV, but HIV is still the most feared out of all of them, especially in like people of today when young people are talking. HIV is the deadliest. Why? Because if untreated, it leads to AIDS, which is fatal death, otilo, gone, finished, like gone. But there are other STIs definitely. So even up to the five, come to someone and say, okay, how far you did not? Do you have sex with condoms? No, I don't catch HIV. Things like HPV, hepatitis, like people don't really know about them, and people that know about them don't even think they think they can just easily treat it and that's it. So I mean, it's great that he shed light to this.
Boils down to using of condom. I still advocate for use of condom.
Yes,
Forget about let's leave
strapped.
HIV aside. Are you comfortable going to the pharmacist every day to go and be treating this or treating that? My sex life is still very, 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 very perfect.
My name is Sean, and I'd like to ask, psychologically, how have you been able to build yourself up to this point? Because I think it takes a lot for you to come out today to talk about this publicly.
Psychologically, it's been crazy. I'm not going to lie. Online, social media, because you see a lot of people online with a lot of hate comments, and you be wondering, like you don't even know me, like you don't even know my reality or my struggles. I'm sorry. There's a lot of sensation that needs to go on. Ever since I came out, a lot of persons will just come to your DM and say, "Oh, God is punishing you for your sins." Hey HIV, hey AIDS. There's a person that will not be in your DMs begging you for sex. The fact that they know that you are positive is kind of making them have a kick or something, and you're like, just so you're putting.
This is society, ladies and gentlemen. Healthy people begging HIV positive people for sex because of a certain kick that they have. You know, I thought I had seen it all. We move.
Me the table and just dissect me like
Is funny, is relatable, is real.
Which is
Wasn't
what you should
making
be in
it
this
sound
society.
sophisticated.
the stigma online is a lot. I would advise anybody who is HIV positive, who is out there, that if you are not ready to come out, don't come out. Psychologically, it's been hard, but if it wasn't for me coming out
And
to
I
talk
feel
about,
like
I would be here.
many people that are saying God is punishing you for your sins, I feel like many of them are Christians. That's just how I feel. Overzealous Christians. That's just how I feel, because we have this tendency where we have this moral high ground because of our religion. I'm not saying it only happens to Christians, but most times Christians have do it. We have this certain moral high ground that we're like, God is punishing for your sins. If a girl gets pregnant, God is punishing for your sins. If a girl comes out and if a girl gets raped, they'll say, oh, what was she wearing? Doesn't she know that she's supposed to dress moderately? Like, a lot of backward, overzealous, inhumane Christians are the ones that propagate this. And I'm very sure that the same people that are entering this guy's DM and telling him all manner of rubbish.
Because you conversation, I'll probably be at home. It was still a blessing coming out for me. It wasn't I don't regret it at all. And if I have to go back to that day, I'll do it all over again.
Okay, so hi.
Hi.
My name is Stella. I just want to ask how, your status has, changed your view on life or like relationships generally. And this doesn't even have to be like a romantic relationship or anything, friendships and all of that.
Coming out now, I now see things differently. I see everything in its own purest color. It used to be black and white for me, but now it's like I see people in different lights. I now learn to no longer expect too much from people. Like, I don't expect you to like me. I don't expect you to hate me. Like, I expect you to see me the way you want to see me, because your perception of me is not something that I can control. I can't change it, so why fight it?
Is there any benefit this HIV has brought to you?
The benefits that I've gotten from this HIV has been countless. I can't count it. Like, nobody might understand it, but I feel like it was a blessing to me, because it's
HIV
what
is a
I'm
blessing?
eating from. I've always wanted to be a humanitarian. God has just been faithful, basically.
Hi,
Well,
once again.
calm down. I understand he works in mysterious ways and whatnot and all of that. But she asked if HIV has given him any benefits. I mean, questions like that, but see, when bad things happen to you, but I understand bad things can help you, they can shape you, they can do this and that. But like, I'm really trying not to offend some people, but like, to say something as terrible as getting HIV has given you benefits, that's, for me personally, I believe you can make the most out of a bad situation. You don't have, it doesn't have to be a death sentence, but like, personally, benefits is actually a step far a bit, if you ask me. But it probably has for him. I just feel differently, if you ask me. I just feel very differently. But we move.
Hi.
I'm Victoria. How do you feel about people that spread this virus intentionally?
Evil.
People who spread the virus intentionally. Well, I cannot say I've ever met someone who I know particularly that spreads the virus intentionally, because, like I always say, for you to be able to spread the virus, you also have to be putting yourself in danger first. So it's now left to you to decide that, is spreading the virus what's putting my life in danger for? Why go through all that stress? Like,
They can happily spread
killing
it.
people really that important to you? Like, can't you just live your life? Like, why is it so important to spread it when you can just take care of yourself and live your life? If they catch you, well.
What do you think when you think about the person you
Imagine
were
catching
before
somebody
your
trying to
diagnosis?
spread
What part of you
HIV
died
then.
and what part of you
That'd
survived?
be crazy.
Before my diagnosis, I used to be this very timid person. If I never became positive, I would have never been able to be strong enough to be able to sit and talk to people because I was a very, if you are talking to me, my head is on the floor. I don't always look at people in their face when I talk to them. After finding out, having to do with all the stigma, everything I had to go through with people and all of that, it kind of made me stronger. It kind of made me bolder, like bold enough to be able to like stand on my own ground. So yes, what died in me then was my timid self, and what awakened is the me that is here now.
All right. So, if you plan to have kids in the future, what part of explaining your HIV status to your partner or your potential partner is the hardest for you?
For starters, you have to ask me what my opinion is about childbearing, and it's simple. It's very simple. Whether or not I give birth to children, it's not going to stop the world from reproducing. Hundreds and millions of babies are being born right now as we are speaking. Now, if I'm going to even have a child, I would not prefer to have a biological child. I would want to have a child that I adopted. Whether or not they look like you or not, that person is still like a new personality entirely. If by chance I say, oh, I want to have child by biologically, of course you have to tell your partner. You can't just like not tell them.
Hello.
And this is what I said.
If you get to find
this is
out
what
the
I
person
said
that infected
earlier.
you, would you be able to forgive them?
This is what I said earlier about the whole thing. Personally, I like him because he's being honest. Whether you agree with him or not, whether you like what he's saying or not, is the truth. He already has HIV. Okay. Listen to me very carefully. Wanting to father a child biologically sounds a bit selfish. Calm down. I understand. I understand. In fact, you know what? I know how weird it sounds, so I'm going to hit the button. I understand. But why would you want to have a biological child where there's a high risk, where there's a percentage of a risk that child might inherit the HIV gene from you? Why would you want to do that to the child? Why would you want to make that child go through what you went through at a young age? So wouldn't it be better to adopt a child, train the child, raise the child up with some precautions so that child doesn't end up contracting the HIV too? If you don't agree with me, let me know in the comment section. But personally, that's my own worldview on the whole thing. There we go.
If you get to find out the person that infected you, would you be able to forgive them?
Nah, hell no. Don't fuck that person up. Hell no.
Well. I've never really thought about it before. So if I find out the person that infected me, I'm going to have the same feeling I had when I found out that I was positive. I'm going to be mad. I'm not going to lie. Like I'm not. If I sit here and say that, I'm going to be, I forgive you.
Nah.
No.
Let's bring like 20 bottles.
I'm going to change down for sharp because what the.
That was a very real statement to me because that person changed his trajectory in life. That person made his path different because if not for that person, they wonon't be here right now.
That person
If I was in
ruined
this
his
place,
life.
I'll be my reaction. I would change it.
Nah,
for
that
the
person
like,
didn't change any trajectory. He didn't change shit. That person straight up ruined his life. Like, fucked up his life. Like, bro. Nah. There's no amount of begging. There's no amount of Jesus. Nothing will make, if I was in issues, nothing would make me forgive that person at all. Nothing. Even if the person didn't know you are. Wait. Then I still won't forgive the person. Fuck it. What I look like?
Before we clear any other thing.
But still, it all depends on how I found out. If maybe the person comes to me to tell me, I will be mad, but I will be forgiving. So I'll give grace in that situation. But if I now stumble into it, like maybe I just go and casually find out from somewhere that the person did it intentionally.
The person's dying. Going to prison for manslaughter.
Let's leave that topic for another day.
Murder. Homicide.
You mentioned you've been diagnosed for 10 years.
Yeah.
So, how would you say the society perceives people living with HIV 10 years ago compared to now? And what type of emotional support do you think the society and individuals can give to people living with HIV?
10 years ago and currently, I think that there has been an increase in uptake of medications, HIV support programs, and HIV awareness.
Do you guys
and all,
remember
and I will give a very big
PLWHA, people living with HIV and AIDS? I've heard about them for like almost a decade now, and I heard about some small groups that like help out, talk to like people with HIV and AIDS and stuff like that. But like, they weren't that much that year. As this was at 215, 40, like thereabouts. There wasn't that much, but now we have chat rooms, we have groups, we have society, we have different things that are centered around making the lives of people living with HIV and AIDS easier. So on that note, I actually like applaud society for being able to do that. Like, let's not make them feel like they are vultures or they are aliens or they're not part of our society. Come on, now HIV then guess no be like say. I had something for that. I'll probably come up with it later. No, like I said they keep person or they won't kill you.
Kudos to organizations who have been championing HIV/AIDS action in Lagos, Nigeria, because they are really trying. However, I feel like there's still a lot of things that needs to be put in place. Like, for instance, if you go for an outreach, they'll tell you, oh, for you to contract HIV, a person that is HIV positive should be the person that is HIV negative. That's what we all know. But what if that person was undetectable? The way we tell people about the most of the they need to revise it. Tell them, give them the right information. Tell them that, oh, a person that does not know their status or is not on medications is a person that can infect someone else, because that is the truth. There are so many women who are HIV positive who are giving birth to HIV negative children because of how medicine has advanced. But they don't tell people this, they don't tell people enough. That's why people, once a guy just says that, oh, my babe has HIV, or if the guy, or if the girl just
Nah, that's fact. I'm sorry. He's right. And I'm going to address something. I made a mistake too. This same video, and I'll call out the mistake I made. I said he shouldn't think of having a biological child because there's a high chance the child gets infected. But I didn't know that there were medications that allow you to still live a normal life, even if like you're HIV positive. I personally didn't know that. So on that note, I was wrong about that. I was actually wrong about that. Like, I didn't know. But now that he's pointed it out, if he wants to have a biological child, he can. That's one. Two. We honestly need to change our mode of like transmission. I won't lie to you. What I know about HIV is what I learned from when I was very small. I'm in my 20s right now. All these news was when I was like 12, 13, 14. That was 10, 12, 15 years. Like, that was a long time ago. The whole mode of transmission, sex, using the same blood transmission, whatever. That's what things we learned back then. Times have evolved. Just what I'm trying to say. Times have evolved. And also, medicine has evolved. Health has evolved. There are so many things that are different now. So, what we were taught in secondary school, in Sunday school, in whatever, where they will bring somebody that is a trained professional and be like, oh, don't do this, don't do that. It has changed. It's not the same thing it was before. Do you understand? So now that it's not the same thing, wouldn't it be better for us to do the research, then also advise the younger ones, that is the youths, the teenagers, people like that, the adolescents, all of them, that okay, how far so thing was what you probably learned, so this was what your mom and dad probably told you, but we're here to correct or buttress some of these things. Do you understand what I'm trying to say? So he actually has a point, because based on what we know, my generation, most of us, based on what we know about HIV, bro, if I'm dating you and you all of a sudden you say you want to be honest with me, I love you so much, I want to be honest with you, I have HIV, I will run. That is the truth. I will run faster than Joseph ran from Potiphar's wife. I will run. I won't even go in my slippers. I won't even go in my trousers. I won't even go in my shirt. I will run, like, away from you, man. Suddenly. And that is the same thing for 90% of the guys in this generation. We will run. We will tiga. Why? Because we have this feeling that even if I kiss you, safe, I don't get that. First of all, it's paranoia. The paranoia will forever be there. That's what's true. That paranoia is there. Secondly, fear. I guess you could equip fear and paranoia together in the same sentence, but they're actually quite different. They're a bit different. But fear, paranoia, lack of sufficient information. Like me, I made a mistake on the same video too now. So nobody's above it. I made a mistake here. I said he shouldn't have biological children because there's a high chance that he's going to infect them too. I was wrong. But sorry, I was only acting on information I was given, that was spoon fed to me when I was much younger. Could I have done research? Yes, but so could I and every other person to watching this video. And I also watch this video too. So basically, we need to improve the way we get pass this information across. That was quite lengthy. Don't know why.
My guy is positive.
I will
She
run
start
too.
having a panic attack.
I will
so
run.
It's
She
people
should
need
run
to
too.
be educated that there's medication. It's free. They need to really educate people that people who are also affected they can be on medication and they don't put you at risk if they are on their medication. You can have sex with them, you can marry them, you can live with them. You don't have to be scared.
Okay, I'm Abdurrahman
scared.
Salu
I'm
again.
still very scared,
My
but I
question
get it.
is, do you have like a community or a support group where you support each other or like motivate each other to take care of themselves?
Yes, of course. We're not islands. We have a community where we come, we talk about our experiences. The amount of persons living with HIV in Lagos is a lot. People have their communities, their safe spaces where they go and talk about their experience. So yes, I have that support group system,
Which
and
is great
it's
for
been
you.
really helpful for me.
Okay, my name is James. Since you knew your status, and anybody walk up to you that they want to pay you to affect somebody else. Yeah.
Yellow foul. Pay me.
You don't have to
men is
answer.
desperately wicked, and people can go to any length to pay back someone they really hate, like their ex.
It's possible, yeah, but if I give you bill, the whole world, like all the whole amount of money you want to give me in this world will not be enough, because what you're asking me to do is put myself at risk first because you want me to infect somebody. Why don't you go and get infected?
I swear, I just got the joke now. I just got the joke, man. Why don't you go and get infected? Then go and infect your enemy. It's easy, fucking easy. You want me to go and infect somebody? Nah, you go get infected. Then go and infect the person that hurts you, so that you understand. So the revenge is more direct. I get that. I fuck with that. I like the idea.
Why are you involving me? You consign me.
Do you believe that God can heal you? I mean, make you whole?
So I believe that God has already healed me and already made me whole. HIV is just a virus. Every single one of us here as human beings are prone. This body that we have is a body that we are not going to have for the rest of our lives. Whether God heals you from cancer or heals you from diarrhea or heals you from everything that is humanly possible to be healed from, it still doesn't mean that you are going to escape what is inevitable, which we all know what it is, right? Coming from where I was 10 years ago to how I look now, I would say that, God does not owe me anything.
There are so many areas where I hear people say that God healed them and they stop taking their medications. You see those people still falling sick. So in as much as we believe...
There was a testimony I heard when I was still in university. I think the girl was trying to say, I think she was trying to chastise herself. I really don't know what the idea was, but I think she was trying to chastise herself, and she was like, that she somewhere along the line she lost faith in God, so she went to the medical center. I was like, what? I'm confused. You lost faith in God, that's why you went to the medical center. Make it make sense to me. So she was not like that. She trusts God. She's not going to make it. And this is that I believe God can heal you, definitely. That's true. But medications and prayer is what leads to healing. Now I'm not a pastor. I'm not a pastor at all. But it's just the same way reading, studying, burning the midnight oil, revising, and praying leads you to success. They go hand in hand. Come on. They go hand in hand. So whether you like it or not, two things are involved. You take your medication, you take your and you pray to God that, oh God, heal me. That is how healing works. You don't just pray and not take medication at all. That doesn't make any sense. Like personally, I just feel like it's I won't say it's a backward thinking, but it's not there. Like, not resonating with a lot of people. Like, how does that make any sense? So yeah.
That God heals us. We should do what we are supposed to do as humans to still take our medications.
Exactly.
Hi, I would like to ask about the financial impact of your medications and how has it been?
There is no financial impact on the medications are free. And that is why it pains me when I hear somebody, person died of AIDS because the person was not. What? It's not drugs for cancer or drugs for diabetes that you have to pay money monthly. But these medications are free. Like, they are free. You can go to any general hospital, go anywhere, they are free. So there's no excuse, there's no financial burden on you for being a person living with HIV. There are so many funding to ensure that person living with HIV still keep getting free medications all over the world.
Okay, so this is Shina again. So after
And shout out to our health system. Yeah, I mean, in Nigeria, it's very easy to say everything is not working, but for the fact that HIV medication is free in current day Nigeria, where prices are skyrocketing and everything, for the fact that HIV medication is free, there's literally an avenue for these people to still live normal lives. And the primary part of it, because let's be honest, it's the medication that's the primary part. Because I know you say the God factor, not all of them might believe in Christ or God, whatever. So, for the fact that the primary thing, what can help them get better, which is the medications, for the fact that it is free, shout out to the public health system, man. Shout out to them. Shout out to them now. So the fact that it's free, shout out. Another time, one time, two times. Let's go. Shout out to them.
After a wonderful session talking to you, I want to ask if you'll be comfortable revealing your identity to us.
Before encore, this guy wants to see my face. Yes, I'll be comfortable, obviously.
And take it off.
Oh, fuck. Finally. Yes. I wanted to reveal my identity from the start. I don't have anybody that I'm hiding from or ashamed of.
Him being able to reveal himself to us shows how much he has grown as a person and accepted the kind of person he is right now, and being able to advocate for people out there that are experiencing the same thing.
Hello everyone, my name is Yede Odezi Jones. I am a person living with HIV.
He's so full of life. He's so full of happiness. He's a beautiful person.
At the end, it's just another guy. It's just another person leading a regular life like myself.
First of all, I've not seen anyone that actually has HIV before, face to face. The way he had this acceptance and flow with it, like this full on, let's say, grace and poise, it's actually lovely.
Such a wholesome moment.
I was expecting a lot of stigma. I'm shocked because it looked like everybody was well informed. The energy I got was very good and it's really impressive.
I think it's very, very important we have conversations like this. This was very, very eye-opening.
Everything he said just broadened my knowledge about the whole idea of HIV. With or without it, life goes on. It is not a death sentence.
He came off as a strong-willed person who has moved past the PT stage, and now he's focused on the mission to empower more people to fight the psychological trauma that HIV brings. So now I'm inspired by him and his story.
I'd like to say a big thank you to the management. What you guys are doing is good work. You guys are opening the way for people to have these conversations and it's good. So just keep it up, Cruz.
If you get to...
Okay, ladies and gentlemen, that was the video. There's always going to be closing remarks from me. Personally, I didn't know a lot about the subject of HIV and other STIs. I admit that I really didn't know much about it. But if I'm being honest, now that you know, I've gotten to understand some things that are different from what I was brought up with, I can tell you this for free. Look, I'm just going to adjust. Look at you. Look you guys directly. Look, HIV is not a death sentence. I know I said this. I know I said it's easy to say it when you're not the one with it, and that I understand. But it's not a death sentence. It's not a death sentence in the sense that if you know anyone around you that's living with HIV, this isn't the time to cut them off. This is not the time to stop picking their calls. This is not the time to stop playing ball with them. This is not the time to start to not to dap them up. This is not the time to shake. This is not the time to not shake them. This isn't the time to push them aside to assume that they were wayward, so that's why they got it. See, even if they were wayward, but so far as you are that person's friend, so far as you are even a human being, how far? See, it's not that deep. Reach out. Try and make the person's life easier. Don't make it out as per. Don't make yourself out to be this Jesus, this moral high girl. But even Jesus converted thieves and robbers and all of them. Like, it's not that deep. Personally, me, I don't have any problem with HIV. People living with HIV, I don't, because the truth is that they are already going through something. That virus, HIV alone, is that the first that comes to mind is they're going to die. That's the truth. So why would you want to make life difficult for them? You shouldn't now. We shouldn't make life. We need to be better. We need to rise above. We need to help. And he said something about different various communities. There are communities that has helped him. Bro, let's foster more communities like that. Like I said in my earlier video about the former drug addict. These are what we need. We need more of these communities. We need more support groups. We need more institutions that would help people that are going through the thick of it, so to speak, that are going through one or two things. That's okay. This is it. And also for us that don't have it, and we pray not to have it in Jesus' name. Let's do our research. Let's do more. Let's try and find out more about this disease so that we are more informed. Like I made a mistake on this video. I made a mistake and I'm the host. I'm done with the YouTube channel, I'm done with everything. I still made a mistake and I correctly said that okay, Alpha, I made a mistake. Now that I watched the video, I know, because now I know better. So together, let's read on these topics. Let's understand what we're doing. Let's know that okay, oh, it's not like this. Oh, sorry, this was just propaganda. What we're doing. Okay. And I feel like if we do that, it will help us better not only understand the situation but understand these people too. It's been your boy A-Box, man. This has been a lovely video, man. I really enjoyed it. Crews have been on a madness lately. Like, there's how many views? 4 point. So many views. It is 111,000 views. So crews have been on a madness, man, and it's going to be my pleasure reacting to more of their videos, man. I appreciate you. So it's been your boy A-Box. Let me know what you guys think in the comment section. Don't forget to subscribe, like, share. Come on, let's grow this channel together. I'm trying to get to 100 within the next 4 or 5 months. Like, I know it's doable. It's doable. So it's been your boy A-Box, and peace.